You made an app about autism. Maybe you can tell something about this.
The first purpose for me was to help the parents to help their homeopath if they go to homeopathic treatment for their autistic child, and to make something available so that they can bring some information about their child, what is important and what's not important, but especially what is important to the homeopath who already gets some actually valuable information. As you can see, so it's mainly for the parents, but obviously any homeopath and anybody who really has an interest in a child with autism can be helped by this. Even a psychologist, could be helped. Again, a school psychologist, the school teacher could be helped by this particular app. But especially for the parents who can bring this kind of information to their homeopath and say, this is what it's all about with my child. As you see on the first screenshot, you clearly see that that we have in the first screenshot, we have the symptoms. I have about at least 250 symptoms that are really peculiar to autism, not just general symptoms, but peculiar, what we can observe with the child. As you can see, we have mental, emotional, and physical symptoms, about more than 200. Here you have the mental symptoms, and you see here, for instance, absent-minded, unobserving behavior. Answers disconnected. We have so many mental, emotional symptoms, and each time the mother finds a symptom that is really related to the child, she can click on it and it becomes blue. It has a blue color. So the mother has first indicated all the symptoms and they become blue in the first screenshot, what's related to her child. If she wants to know what it's related to, what remedy it's related, she can actually see the result immediately. Here is just this one screenshot in which we have only put a few symptoms. And right away she gets a selection of remedies. The top remedy first, second remedy, and so on and so on. All in all, there's about 26 remedies in it. The 26 top remedies, you could say, all polycrest obviously, that are mainly, I could probably say, for 80% of the autistic, for children with autism, are in these 26. So she can right away bring this information. It's not to treat her child herself, obviously, that should never be done. But it's more to concentrate on the symptoms that the homeopath wants to hear. Because otherwise, parents have the inclination of just saying general symptoms, that we all know what an autistic child has as general symptoms, but not peculiar, not really precisely what their child is unique for. And that's what you get with this app. You can get the unique symptoms of your child, which we as homeopaths want to know. They already can bring this information, even have an idea about the remedy that's needed. For the parent, it's very interesting too, that they can then at this time say, look, what it is about, this remedy, that was the first remedy, belladonna. And then they can actually, in the fourth screenshot, they can actually read whatever it's all about, what belladonna is all about. So here they have a description, possible description of their child, if the remedy comes out on the top, as you see. So it has a description already. They can see what is it about. It talks about fixed ideas. It talks about behavior symptoms. It talks also about what their compensation, what does my child do to deal with this. And of course, it also talks about causalities, what caused such a condition. All this is very valuable information for the parent, who can bring all this to the homeopath. Because otherwise they will never think about these things. They will never connect causality, what is specific for my child. I know from the practice, I usually had to ask all the time, yes, but give me an example that pertains to your child. About, oh, my child is not behaving very well. Yes, but that doesn't mean anything for me. I want to know, but give me an example. What this app does, it particularly right away focuses in on really what's related to their child, their peculiar child, their only child. It's different than any other child with autism. So this is what really the great value is of this app. It's very cheap, and it's a fantastic start for a homeopath who gets a patient like this, who comes with this kind of information, and knows then right away that the parent of such child has concentrated, focused on the right information that he wants to know, and obviously he will elaborate about the symptoms and further ask about it, and therefore gets the picture much clearer. But at least for me, that's the great value, that the direction is right away chosen to put the accent on the certain symptoms, that the parent is not stuck on general symptoms which we can do nothing about.
More focused on what is really necessary to find the remedy.
Correct. It's more focused on the aphorism 153 symptoms, as we call it, right? What's the peculiar, rare symptoms of the patient, which for us are much more valuable than any of the general symptoms, which we're not going to use to find the remedy. So here the parent can help the homeopath a great deal through this app by focusing on what's really important for her child.
And I see a belladonna now. Is this a belladonna from Burke, or is it from someone else?
Actually, I made this up myself. I mean, all these descriptions I made because at the hand of truth provings, of course, right? At the hand of hearing is my favorite one, you know, on true materia medica. So I made this myself. Just in short, obviously, you cannot put pages and pages. In my book, when my book appears, it's for each remedy it's like 10 pages, so you know, with examples and everything. But here, it's enough information for the parent to see, does this really pertain to my child? Or maybe this other remedy that they see number 2. They can just click on the number 2 and they get the same reading. They can read about all the remedies. Mm-hmm. So maybe they might say, oh, this really pertains more to my child. And that's another valuable information they can give to the homeopath, who then is already on the track and see if he can confirm it by investigating further, of course. And again, like I said, it should never be the task of a parent to do such treatment, even if they can't get the remedy in the store. If we talk about a chronic treatment, and that requires truly a professional homeopath to follow the case.